One of the most common problems that I see nurses getting reported for is the failure to keep accurate medical records. Now, this takes many forms. There are sins of commission and sins of omission, failing to write down information, and also maybe writing down incorrect information, maybe even falsifying information. So these are very typical things. There's also just negligent acts that are done. So some of the things I see are as follows. I see nurses who are unfamiliar with a new software program, either an update or at a new work assignment using a different software, and that happens. Then there is malfunctioning software, not the fault of the nurse, but the software fails and they get blamed for the mistake. I also see nurses who fail to waste medications in front of another nurse. This is one of the most common problems that I see. And there are very specific protocols with which you need to become familiar and get them burned into your memory, that you have to have another nurse witness and sign off on the wasting of medications. Some of the protocols change slightly from location to location, but it's never going to be okay to waste a narcotic unless there's another nurse watching and verifying that it was done. And there's a lot of sloppy shortcuts that nurses take having to follow this procedure. So just don't fall into that category. I've seen nurses who do home care, home visits, who will try and use data from a prior visit or just make up information about a patient's vitals because they're running late, running two different jobs, etc. Never a good idea to falsify medical records. I have nurses who get in trouble for not writing down the information during the time that their time slot is available. And usually it's because they're being overworked and they don't have time to both take the notes and to service all of their patients. That issue should be brought up, especially in writing, with a supervisor or get additional training to learn how to do this in a proper and effective way. So again, maintaining medical records is very, very important. The number one problem is not wasting the medication in front of someone else. This can lead to allegations of diversion or of drug abuse or theft. And it's super, super important to never, ever forget to do that.